everybody. Welcome back. We've had a bit of a break because I've been away, so we've had a gap, a 2-week gap. So maybe the message hasn't spread that we're back on, because there's quite a few regular faces on here tonight. Not to worry, they can watch the video, and I'll stick it up later. Is everybody well?
Yes.
We're well. We're well. Good. Well, there we go. You're going. Everybody's fine. What are you doing here? Get out there and enjoy the sunshine. Right. So, for the benefit of our new faces this evening, so welcome to our little group. Dear Mindfulness Group, we meet every Wednesday at about this time, and we do a bit of mindful practice. So there's a couple of exercises that we do as standard every week, which bring us into the present moment, because that is what mindfulness is all about. It's about being in this moment right now, because this is the only moment that we have in which we can experience our lives. And the past has gone, can't change it, can't do anything about it. The future hasn't happened, we don't know what's going to happen. We can try and predict, we can try and plan, but that's not necessarily always going to help us out in the long run. The only moment in time that actually matters and that actually exists is this moment in time right now. But we don't actually spend often a lot of time in that moment. We're too busy thinking about what we've done in the past or thinking about what we've got to do in the future, and then don't stop to be aware of what's going on around us. So that's what mindfulness is, and that's what the practice that we do helps to cultivate. And the general format for our meetings, for those of you that don't know, is we do an exercise, then I do a bit of a talk, and then we do a bit more of an exercise, and then maybe I'll do a bit more of a talk, and it's all quite fluid, and I tend to make it up as I go along anyway, because that's the way I like it.
Because you live in the moment.
Because I'm in the moment. Exactly right, Carol. I'm in the moment, and in fact, I had to do a presentation at a conference last week. It was a really boring IT conference, because I have another job that I do to pay the mortgage, and as part of that, I had to give a presentation talking about some aspect of website design. And I got halfway through it, and I just thought, this is ridiculous. And I just stood there and said, are you lot bored? Because I'm bored. And just went off and just started talking about something completely different. and then some woman came up to me afterwards, and she said, you started rambling. Yeah, I do that. That happens, but anyway. Right. We'll start with the sitting exercise. As everybody is sitting, that would be a good place to start. So this exercise that we begin with is we go through the steps of engaging our senses. So our senses are what tell us what is going on around us in this moment in time right now. And so if we can engage our senses, we can build up an awareness of where we are in space and time and what's going on around us. So that's what we do to begin with. So, what's that word again? Right. We begin with our eyes and our vision, and we just start by looking around and just taking in what we can see. Colours, shapes, visual texture. It doesn't matter what we can see, it doesn't matter what we're looking at, we're just looking. Being aware of what our eyes detect. And once we've had a look round, we can close our eyes and we can turn our attention to the weight of our body sat on the chair. You can be aware of your back pressing against the backrest. Aware of the weight of your bottom pressing down into the seat. Aware of your feet in contact with the floor. And going back up your body, you can become aware of your head. Sat on top of your neck. And what's quite nice is you can also become aware of any tension that you're holding in your neck and your shoulders. And as you become aware of it, just feel it beginning to evaporate slightly. And just relax out. You can bring to your awareness the clothes, the fabric of your clothes. Aware of it in contact with your skin, on your arms, on your legs, your chest. You may even become aware of the very faint movement of air. Your hands on your face, on your neck. Now take a nice breath in through your nose, just smell. You're not trying to smell anything in particular, you're not trying to detect a particular smell, you're just being aware of smell in this moment in time, right now. And now taste. Become aware of the taste in your mouth as it is right now. And then the final sense to engage is our hearing. And the method here is to start by becoming aware of the sounds that are closest. Just gradually extend the field of your hearing, and you're just allowing the sound to enter your ears. Just being aware of the sound as each individual sound happens in each individual moment. And if your mind wanders, if thoughts and ideas come into your head, it doesn't matter. It's absolutely fine, because that's what happens. Our brains generate these thoughts and ideas all the time. But just notice that it has happened. Be aware of what the thought or the idea is. Be aware of the fact that it is there. And then just bring your awareness back to listening. Just listening in the present moment. what's nice about this is we're not sitting in silence. It's not about finding a secluded spot where it's silent and you can just sit. It's about being aware of the sounds that are around you. So even if you've got the road diggers outside, or noisy neighbours, or a garden full of screaming kids, it's just stopping to be aware of those sounds that are around you. The sounds of life. Just being aware of them and accepting them. Not labelling them or judging them or feeling or reacting to them, feeling angry, aggravated by them. Just accepting and being aware. And when you're ready, you can open your eyes. So I declared the other day that my talk today would be about side effects. I'm sticking with side effects. I said I reserved the right to change my mind, but I haven't changed my mind. I didn't know what I was going to talk about, just out of topic. And I've now decided. Now anyway, so, side effects. Side effects we generally associate with medication, medicines and tablets and pharmaceuticals. And we go to the doctor, we have symptoms for something, for a condition, and we go to the doctor and we say, "Doctor, these are my presenting symptoms." And he listens and he goes, "Yes, yes, yes," or he or she will listen and go, "Yes, yes, yes, okay, it sounds like it's this." And as is their tendency, they will write out a little prescription. They'll say, "Take these for however long." Does anybody here take medication regularly or has taken? I'll put my hand up, I do, daily basis. Yeah, so there's quite a few of us, slaves to the tablets. I brought this is my little leaflet that comes with my medication. Pardon? Little leaflet, yeah. It is only two sides though, it's not one of those foldy out ones, like you get with some of them. And we look at this and it says how to take them. Well, they're tablets, you just shove them in your mouth. And we have point 4, possible side effects. And then it lists them out. And we start with common side effects. So these can affect less than 1 in 10 patients. Headache, changes in blood pressure, flatulence, nausea, bloated or painful stomach, diarrhea, indigestion, vomiting, abnormal liver function test, itching, rash, muscle and joint pain, back pain, weakness and fever.
And they're supposed to be
They're
really
the common
good.
ones. They're the common side effects. Uncommon side effects, seen in less than 1 in 100 patients. So that's quite high, really, isn't it?
Absolutely.
1 in 100. Well, I suppose less than 1 in 100. Anyway, so the uncommon ones. Reduction in blood platelets, which increase the risk of bleeding and bruising. Dizziness, feeling sleepy or tired, trembling or shaking, ear pain, racing heartbeat, changes in blood pressure, an inflamed pancreas or colon, associated with pain in upper abdomen and back and feeling sick. Rectal polyp, that's a nice one. Acne, hair loss, itchy skin with or without a rash, hives, swollen face and fatigue. And then it goes on, and there's some more. Inflammation of the lung, wheezing, hepatitis. Anyway, so yes, these are things that are supposed to make me better, make me well. And they come with these side effects. So side effects, when we think about them, in the classic sense, when we associate them with medication, which is obviously what we do when we want to feel better, and we're given medication, and it comes with this, are generally quite negative, are they not? I like to try and sort of flip things around a bit. That's what I do with my little talks. I like to try and encourage people to think differently, or think about things in a slightly different way. So, And obviously the general theme is mindfulness. So if mindfulness, the practice of mindfulness is our medication, what were the symptoms? So I suppose the symptoms would be that you weren't living in the moment. You know, you were distracted by the past, preoccupied with the future, feeling stressed and anxious because you're concerned about the past and things that you've done and things that you said, or getting stressed and anxious about the future and how it's all out of your control, and you're not in the present. So they're the symptoms. And you would come to a group like this, and your medication will be a dose of mindfulness. Have some mindfulness. I should have printed out a leaflet for you all, shouldn't I? How to take your mindfulness. And obviously you take your medication, and it acts in the body in its particular way. So it'll make you change your chemical composition, or reduce the production of this, or increase the production of something else, or change the way your body responds to a particular thing. But with our mindfulness, we take the medication, and it is just about bringing us into the present moment. In whatever form that may be, whether it's the sitting exercise or the breathing exercise that we'll do in the moment, in a little while. So that's our medication. And what I think is particularly great about mindfulness as a practice for benefiting your health is that actually the real benefits and the real positive change, because that's what it's about invoking change. That's why you go to the doctors to get tablets in the first place, to change things. The change and the benefits from mindfulness come from the side effects. So if mindfulness is your medication, and you take your, every day you do your little bit of mindfulness, you don't do it. We know that. Mindfulness is not something that you do. It's a way of being. You be mindful for a period every day, as prescribed by Dr. Jim. You be mindful for a little while every day, and you begin to notice that things change. People have reported it to me. You've said yourself, Annie, that things have changed and are different by practicing it. And actually, they're the side effects. It's the side effects of mindfulness that are the really good stuff, the bits that really help you. For example, I've talked before about being mindful with other people. When your spouse, partner, significant other, whatever it is bending your ear and giving you a hard time, or venting their own frustrations, you could choose to just react and shout back at them, or you could be mindful and just get into the moment and then empathise and communicate much more effectively, because that's what happens when you're mindful. You communicate more effectively and efficiently because you listen and you can respond to what they're saying because you don't react. And what's the side effect of that? The side effect of communicating more effectively with your spouse, partner, significant other, whatever you want to call them, is that you don't get embroiled in those arguments, and your relationship becomes more solid and improved. With your kids, for those of us that have children, young children, even those of us that have older children, if you can be mindful with your kids and in the moment, and respond to them in the moment, rather than be thinking, it's always the same, every time I ask you to do something you don't do it. But if you're in the moment, again, your relationship with your children, because kids are in the moment, becomes so much more just better, generally. And again, that's a side effect. It's a side effect of being mindful. Your relationship with your kids improves. Same at work. For those of us that have to work, sit in boring meetings, or talk to people on the phone, or and do all that kind of stuff. The tendency is for us to get bogged down with it, to think, oh, the drudge, and it's the same every day, and I keep having to do this, and they don't listen, and we get frustrated by our work colleagues, or frustrated by our clients and customers, and all the rest of it. But if we can be mindful, and we don't judge, we don't label, we don't get preoccupied with the fact that that's what they were like last week and the week before and things never change, but we just accept that this is how it is in this moment. The side effect of that is that we don't get stressed out at work. We're much more tolerant. We become more efficient communicators. We get more done. We're less likely to procrastinate. All of those things that get in the way of being successful and efficient. So because I had this the other day, somebody was talking to me about mindfulness, and they were like, it just sounds really flaky. Just be in the moment, and you just, nothing matters because you just accept it, and that's how it is. And I said, well, yeah, you do. That's how it is. That's all. The only moment you've got is this moment now. And they said, well, what about memories? I said, well, when do you experience memories? You can only experience a memory in this moment in time now. Said, well, yeah, but what about planning? It's like, well, yeah, planning is something related to the future, but the act of planning is something that you do in the moment. I don't get it. It sounds flaky. And I can see that. I can see how people think that it's one of these sort of, new age hippie things, and you're just really laid back, and nothing matters, and we just accept it because we're mindful and we're in the moment. We don't have to worry about, we don't have to plan anything. We just, blissfully stroll through life, not caring and being mindful. But it's not true. It's not true. Because it is whilst it may not seem dynamic and, you're out there changing the world, the beauty of mindfulness is that all that dynamism, all the changes, all the really powerful stuff happens as a side effect. It just happens in the background. If you can cultivate your mindfulness and practice your mindfulness, because that's the hard bit. It is dynamic because it's not easy. Being mindful is not easy. It's incredibly simple, but it's not easy. Because our brains don't make it easy because they keep generating all these stupid ideas. Other people don't make it easy because they stand there and go, yeah, it's all flaky and it's, What about memories and what about planning? And they don't question it. And it's not easy, and to do it requires discipline and there's a dynamic element to that. But the real change, the real benefits come from the side effects of it. Which is why I think it's so great. Because you don't have to, well, for one, you don't have to have a list of things like that. Stupid stuff. You allow it to happen. You accept the moment, and all the good stuff just comes, and it happens. It takes dedication, and it takes time, and it takes commitment, but you don't have to. You just take responsibility for being in the moment. You don't have to take responsibility for the other stuff. So that will just happen. It's a side effect.
You let go of something bad happening in the past.
Yeah.
Does it help you?
Yes, it does. Yes. And that's exactly it.
That's what I want to help with.
That is exactly it.
Yeah.
Because
I can't really think about what's happened. But
no.
I want to get on with my life.
You can't change the past. What happened in the past has happened.
Yeah.
So step one is to accept that fact.
Yeah.
And you just be aware of and accept that the past is the past. And I can't go back, can't change it, it is what it is. Yeah. And you don't even have to move forward, because that moving forward happens by itself, because that's what, there's this moment, and now there's this moment, and now there's this moment, and that just keeps happening. And all you have to do, you don't even have to do it. All you have to be is in this moment, and then in this moment, and then in this moment. And the side effect of being in the moment is that any damage caused by events in the past I often say it loses its potency. It loses, because that's what it is. It's the same with negative ideas. People generate negative ideas in their head, telling them that they're worthless or they're pointless. Critical, negative ideas, and they get hold of people. And it's often based upon past experience. And the reason that they're so damaging is because they're potent. They're strong, exactly. They're strong and they're potent. But by being mindful and being aware, they can lose their potency. They lose their strength. And it's the same with holding on to things from the past. Holding on to the way that you feel about past events. And just by being aware of it, because that's what mindfulness is about, awareness. Being aware of the past, but being aware of the fact that there's this moment now, that damage from the past loses its power. And it's a side effect. It's not an instant thing. It won't happen like that. But it's gradual. And that's why it's great for, I'm sure Carol will tell you, because you lost your husband. And that's a painful experience. But by practicing mindfulness, it doesn't mean that the relationship you have is undermined. It doesn't mean that you love them any less. But the way that you can cope with that loss becomes a side effect of being mindful. And again, it's like, it's not that flaky thing where, nothing matters. Because it still does matter. It does matter. But it becomes a side effect, and it happens of its own accord, which is why it's great. Because some therapies, and it happens in some of the other therapy that I do. I do hypnotherapy, and I will make people face stuff head on. We'll go back in time in hypnosis. We'll go back in time to a particular event, situation, and we'll relive it and confront it head on. And make people experience and feel the way they felt at a particular time. But in a way, it's kind of, I always try and link it with mindfulness, because I want to make people aware of how they feel about something. Because if you can be aware of the feelings, because the damage comes from locking it away. People bury it. People something will happen in their life, they can't deal with it. Can't deal with how they feel about it. They don't want to be aware of how they feel about it, should I say. And so they bury it down. And then it just sits there. And then like the side effects that you get from these, that experience from the past that you couldn't cope with being aware of how it feels, then sits there, stagnating, generating all these kind of side effects, making you feel nauseous, making you have rectal polyps, and all the rest of it. That's what happens. It does. But mindfulness doesn't. It can be much more gentle, but at the same time incredibly powerful. But it's not easy. Right. Enough talk of polyps. Let's do some breathing. So this is my favourite exercise, or my favourite area of practice, because it's so easy, and you can do it anywhere. You can do it walking down the street. You can do it when you're at work. If you're in a meeting with a load of idiots, you can still breathe mindfully. If somebody is talking a load of old rhubarb, you can still take a mindful breath and pause and be in the moment and accept the rhubarb that's coming out of that person's mouth and be better for it. So,
It's alright, we're not counting.
you're not counting the sounds. I don't think I say it as much as I used to.
No, you don't.
I think I've curtailed. I'm mindful of saying so. Okay. Breathing is great because you breathe in the present moment. Everybody else has heard me say this, so I'm kind of looking at you two because you haven't heard me say it. You can't breathe in the past. You can't breathe in the future. Each breath happens in the present. So if you can bring your awareness to your breathing, then you instantly are transported into this present moment, right now. And we'll begin. So you're sat. If you want to close your eyes, you can close your eyes. If you want to keep them open, you can keep them open. I've got the bowl, so if I bong the bowl a little later on, that's just a little reminder to you that if your mind has wandered, to bring your awareness back to your breathing. And begin by being aware of the breath in your nostrils. And just be aware of the movement of air in and out of your body. At the nostrils, the point between inside and outside. And then you shift your awareness back slightly to the back of your throat. Just feel the breath and the movement of air at the back of your throat. In and out, each individual breath as it happens. Now follow the breath down a bit further to your chest. And now you can be aware of the movement of your body. So as the air passes in and out, you can be aware of the rise and fall of your chest. Just follow each breath as it happens, in and out. Now be aware of the breath right at the base, the bottom of your lungs or your diaphragm. Be aware of the movement of air and the movement of your diaphragm. Each individual breath as it happens. And then we introduce the third component of the breath. So we're aware of the in-breath, we're aware of breathing out, and then we become aware of the pause between breaths. Three aspects of the breath: in, out, and pause. Just allow yourself to relax into that pause. We are human beings. We are not human thinkings. We are not human doings. At this moment in time, there is nothing we have to do, nothing we have to think. We're just being. It's being alive. And so as you breathe in, be aware of feeling alive. As you breathe out, Allow yourself to smile at the fact that you are alive. And then as you pause between breaths, just allow that smile to relax into that pause. Just follow your breath. Enjoy just being. And when you're ready, you can open your eyes. And that breath is always with you. Even when you're asleep, you're breathing. And if you're not breathing, you're not being, because you're dead. So the breath is always with you. And all you have to do is just bring your awareness to it. And you can do that at any time, as I said. You can do it when you walk into the shop to buy milk. You can do it when you're in boring meetings at work. You can even do it when the kids are driving you mad, because they're screaming the house down. You can still tune into those three aspects, the in, the out and the pause. Be in the moment. And then respond to whatever the present moment is offering you. Thank you very much. See you next week. Lovely to see you. As always, everybody's welcome. And I look forward to seeing you all next week.